Nigeria is facing a medical emergency after declaring an outbreak of cholera across the country. In an update, the Deputy Director of Surveillance of the Nigeria Center for Disease Control (NCDC), a National Incident Management Manager for the center, Dr. Mukhtar Hassan, said a total of 54 deaths and 1,579 cases have been documented in 32 states and 107 local government areas, with a case fatality rate of 3.5%. In the wake of the outbreak, the federal government announced that cholera vaccines are not stocked in public facilities, though they are available in limited quantity in private sector. However, Nigeria has initiated discussions with Global Alliance for Vaccines and Immunization, Gavi, towards obtaining emergency supply amid a global shortage of the vaccine. Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pati, is leading the discussions. Nigeria utilizes 3 World Health Organizations pre-qualified oral cholera vaccines, the Dukoral, the Shankol, and the Uvicol Plus. The 3 vaccines require 2 doses for full protection and are administered only to persons and groups at high risk, such as travelers to areas with active cholera transmission or people living in areas experiencing outbreaks. The provision of vaccine and other measures to curtail the spread of cholera will dominate discussions on the program. Thanks for joining us. I am Eucharia Clinton, and welcome to Nigeria Today. Now, joining me in the studio for the conversation is Dr. Isaac Eboja, a public health specialist. You're welcome to Nigeria Today.
You're welcome. Good evening.
Now, also joining the program via Zoom from Nairobi, Kenya, is Dr. Simon Agwale. He's the CEO, Innovative Biotech Nigeria. He's also the Vice Chairman, Africa Vaccine Manufacturing Boards of Directors. Good to have you join us, sir.
Thank you for having me.
Now, I'll start with you, Dr. Eboja. Now tell us, why is it somewhat seemingly difficult to curtail the spread of the disease, cholera, in Nigeria?
Well, one of the reasons is because cholera is a waterborne disease. And when one's water is contaminated, that water carries the bacteria. Chances are that those who use the water, who consume the water, will be affected. And there is hardly anybody, well, there's nobody who doesn't use water. There's nobody who doesn't need water, either for drinking or for bathing or for washing, whatever. We need water on a daily basis. Next to that is the fact that our sources of water are very poor and unsafe. Normally, we should be having pipe-borne water, which is supposed to be safe, treated water. But we don't. Majority of Nigerians drink water from the wells, from the streams, from the rivers, and the ponds, wherever they find clean water, relatively clean. That water looks transparent or looks clean does not mean that it does not contain organisms that would cause health problems. And because of that, we have a lot of problems such as cholera. Then, of course, the third reason is the open defecation that is practiced around the country. I'm worried about this because when this particular outbreak started, it was a few states. Now it's spreading. And you know that in most of our states, open defecation is practiced. And because of that, and the fact that this is rainy season, water carries the feces to sources of water, gets them contaminated. People consume or use those sources of water and get into trouble. Then, of course, the issue of personal and environmental hygiene is still a challenge in our communities. Lots of people don't wash their hands as regularly as they should. And if you don't wash your hands, and your hands are contaminated, and you carry food to eat, you are carrying contamination, whatever the organisms that are in your hands that could cause you a health challenge would of course do their job. And the fact too that a lot of people eat fruits, vegetables that are not totally or properly washed, or they are not cooked. Even foods that are supposed to be cooked, some people cook haphazardly. And it doesn't even make any sense if you cook food well, kill the bacteria in the process of cooking, but you serve it in a contaminated plate. It's still contaminated. So we have multiple reasons why we're having the problem that we're having now.
Okay, I know the rainy season has also been said to exacerbate the whole disease, the spread of the disease. Now, Dr. Agwali, Nigeria has declared, shortage of vaccine. Now, looking at this situation, we have experts. One will be wondering, why should cases like this arise when we have experts that involved in Nigeria that are involved in human vaccine production? What do you have to say to this situation?
Well, thank you for giving me this opportunity to talk to Nigerians. I'm actually in Nairobi, Kenya now, where I'm attending the second edition of the global event on harnessing private sector engagement for sustainable vaccine and pharmaceutical manufacturing in Africa. The reality is that currently there are only two cholera vaccine manufacturers in the world. One is in South Korea, and then the other one is in Bangladesh. So, and that is why we have shortage of cholera vaccine globally. So how are we trying to address this issue? The only way to solve this issue is to build local capacities to produce our own vaccines locally. You have typhoid, you have Lassa that is also killing people. This is uncalled for because we can make this happen. But the good news is that the Afrexim Bank is supporting us now to build local vaccine manufacturing in the country. So maybe in the next 2 years or so, we should have that factory up and running, and then we'll be able to overcome these vaccine shortages. Again, if you look at the COVID, we had that experience as well. And it is surprising that this is almost 5 years now, and we don't have a functional vaccine manufacturing capability in the country. So this is unacceptable. But again, it's not too late. We, like I said, fortunate to secure this funding from Afrexim to build this vaccine manufacturing facility. Here, countries are making efforts. BioVac in South Africa has just licensed the cholera vaccine from the International Vaccine Institute in Korea to do what we call the end-to-end. That is producing the drug substance, which again is like the API, and then they fill and finish. So these are all the interventions that are going on to make sure that this does not happen again. And cholera, again, is one of the vaccines in our pipeline that as soon as our factory is up and running, we will be producing in Nigeria, and we will be able to overcome this devastating situation that is ongoing.
Okay, thank you very much for that information. And of course, there's hope. Now, a little away from the vaccines. Now, let's talk about prevention. Now, you've mentioned some of the reasons why we have this disease, why it seems to be difficult to, to curtail or to contain in the country. So, what are some of the preventive measures that one should be, be conscious about in the country?
Well, what I said is actually related to the prevention. The number one thing is the source of water that or the water that we use. If our water is properly treated with chlorine and our pipes are working, they're not leaking, then we would have a good source of water, drinking water. And even for that, it is only in towns, in cities, that we have pipe-borne water. If you go to villages, there isn't such facility that you will find in most Nigerian villages. And you know that majority of the Nigerian population is in the rural area. And therefore, majority of Nigerians don't have access to potable water, safe water. That's point number one. Point number two, our personal habits, our behaviors. People don't usually like washing hands as frequently as they should. You recall that during COVID, people were forced to be washing their hands as frequently as they were told because they saw death staring at them. And it was an issue of either you do it or you get into trouble and you die. And when people don't see an emergency, they take things for granted. And personal hygiene is very important. Environmental hygiene and sanitation is also very important. We need to have, every family need to have a toilet, a functional toilet. Even if it's a pit latrine, it's okay in the rural areas. We need to have those. Many states are doing well, but majority of the states, if you go to the villages and you go to the local communities, there are many households that don't have functional toilets. And even when they do have, some of them are not properly kept. Flies can go into them and come to perch on foods that people consume. And even within towns, you see some places where the toilets, at the back of the toilet, you see pipes leaking and so on, which shouldn't be the case. We should try to solve that problem as soon as possible. Environmental hygiene and sanitation is a must. And you know also that this is one of the goals of the Sustainable Development Goals. And this is the reason why we should commit a lot of resources to this, human resources, material resources, and financial resources. And these are things that we can do for ourselves and by ourselves.
Okay, thank you very much. We'll take a breather here and listen to a cross-section of Nigerians on what they know about the cholera outbreak in the country, as put together by Kemini Williams. Don't go away.
They should sensitize people down to the grassroots, because a lot of people don't really know what this thing is about. They prepare food in unhygienic and unsanitary environments, which is a very good festering environment for cholera and other diseases. So hygiene and environmental hygiene should be on the top notch. And then also sensitization. People should prepare their food in very clean and sanitary conditions. Like me, since the outbreak, I've been scared of eating stuffs outside because I don't know where I might pick it from. And from the analysis they carried out, they found out that most of this cholera outbreak can be linked to tiger nut drinks that are not registered. I'm not trying to spoil the business of people who are trying to make ends meet through this means, but I feel they can also sensitize them so that they can put in maximum sanitary conditions when preparing these locally consumed food and drinks.
People actually don't know what this cholera is all about, the meaning, the science, and what could actually cause it. So I feel there should be an enlightenment, and also there should be, probably due to the high risk of the outbreak now, an increase in price of things. Probably the healthcare should actually give us a discount price, a price of reduction, so people can actually afford these things. And also, people should actually, not only in the ministries and not only at work, even in the churches, everyone should be enlightened about this, and proper care should also be taken.
Welcome back. This is still Nigeria Today, and we're looking at the containing the spread of cholera in Nigeria. And I have two gentlemen with me, one via Zoom from Nairobi, Kenya, and one here in the studio. Now, Dr. Agwali, you had the reaction of people there. They talked about vaccination. However, want you to tell us, what are the most critical areas, for immediate action to combat cholera in Nigeria?
Well, I mean, the doctor with you there has elaborated on that, the importance of treated water. And again, like he said, some of the drinks that are commonly used in Nigeria, and we don't know the sources of the water they use to make drinks. So we just have to be very careful with what we drink, because we don't know where they get the water to prepare those drinks. So that's basically what I would say. But at the end, the bottom line is get people protected, because this is a vaccine preventable disease. So let's work on getting these vaccines available to people that need them, and end the epidemic.
Back to you, Dr. Isaac. How can Nigeria improve its public health infrastructure to better, handle future outbreaks? Because now it appears this one caught us unaware, sort of.
Well, I wouldn't agree with you when you say it caught us unaware, because cholera is not new to us. We've been experiencing this even as recently as 2022. We had a big deal of it, and a few people died. And right now we are having an outbreak. We don't know how far it will go. We pray that it doesn't spread any further than where it has reached now. So it is not a new problem to us. What I would request is that everybody, especially our authorities at the federal level, at the state level, at the local government level, everybody should step up, especially about the provision of water. If you cannot provide pipe-borne water for everybody, at least we can have tanks, overhead tanks, that are filled with treated water, and from which water can be reticulated to those in the neighborhood where such tanks are situated or located. We can do that. If you see many times when boreholes are sunk and the authorities go there and they put a cup under the pipe, and they get the water from the borehole, and they drink, and everybody clap hand, as if it's a big deal. It is not a big deal to have water. Water is a right of everybody to have. And let me also emphasize on the fact that while we say that cholera is a vaccine preventable disease, it is also a behavior preventable disease. We can prevent it by our behaviors, making sure that we wash our clothes, ourselves, our foods, especially foods that are not cooked very well, making sure especially that if you must have to eat something that is not cooked, you wash it, and you make sure that if you have salt, you use salt to wash it. If you don't have salt, you wash it as many times as possible, rub it, make sure that it is clean, and make sure that those who cook food and who serve food are also careful and are also clean. Let me also give this advice to the public. At the moment, I wouldn't advise travelers in particular to be drinking water or eating food by the roadside. That's one source of trouble for the public. If you travel on Nigerian roads, you see mama put here and there. And if you go to the back of those restaurants where they cook those foods on the roadside, you would not eat the food that they give you. I tell you, you won't. The water they use to wash the plates sometimes is the same water from morning till afternoon. They just use a whole bowl of water. All the plates go there. They take the plates and they just rinse a little bit and they come and put it and they put food. That is dangerous. And there are people hawking salad to offices, fruits everywhere in Abuja, for example. You see apple, all kinds of fruits being hawked. And we should be careful with this. I'm not saying you should not buy. I'm saying if you buy, make sure you wash them very, very well before you consume them.
Okay, now, Dr. Agwali, one last question. Now, what happens, now in talking about the vaccine, now what happens to those that, that receive only the first jab? We have a situation where people, I understand that you have doses, first jab, maybe second jab, and the rest of them. So what happens to only those that receives, only the first jab without going for the second shot?
Well, I mean, they are protected in an emergency and in a situation where there's shortage of vaccines. One dose is recommended because we don't have many doses globally. But the ideal is to take 2 doses 2 weeks apart, and studies have shown that that can protect the individuals for up to 5 years. But in this current situation that we find ourselves globally, that is what is being used in countries where we are experiencing this epidemic, so that you have more people protected. Because if you have more people protected, within a short time, we'll be able to create herd immunity that will protect the entire community from the disease.
Dr. Boja, we've always talked about the disease of how and how it's been, some persons that do not have knowledge of what it's all about. What are some of the symptoms that one should look out for, and what exactly should you do? Because we also know that it's also a treatable disease.
Yeah. The common symptoms are diarrhea, vomiting, nausea, and dehydration. And when you see somebody that has or that is having cholera, the diarrhea is profuse. The diarrhea is continuous. It's not like every 30 minutes. It's almost like the person is permanently stooling. And this is the reason why they get dehydrated very quickly, because they are pouring all the water from their system through the diarrhea and also the vomiting. The patient would be vomiting and at the same time be stooling.
Okay. So what should you do then?
What you do, you have to make sure that you replace the water that they are losing. Very key, very important. Because sometimes what kills patients is not the poison from the bacteria, it's the dehydration, the loss of water from the system. So make sure that you drink water. Now, it is the same water we're talking about that is contaminated. So the water has to be boiled. And also you can use ORS, oral rehydration solution. If you have the sachets, fine. If you don't have the sachets, boil water. In 1 liter of water, put 1 teaspoon of salt and 7 of sugar.
Okay.
I mean, that's 1 spoon.
Yes.
Mix it very well and drink as much as possible. After 24 hours, that will not be useful again. You will make a new one. Okay,
thank you very much. With that, we draw the curtain of today's episode of Nigeria Today. A very thank you to Dr. Isaac Eboja, a public health specialist. Thank you so much for your thoughts and your contribution.
My pleasure.
And also via Zoom from Nairobi, Kenya, we had Dr. Simon Agwali. He's the CEO, Innovative Biotech Nigeria. He's also Vice Chairman, Africa Vaccine Manufacturing Board of Directors. Thank you so much for being part of the program, sir.
Thank you.
And thank you for being with us. Don't forget, Nigeria Today airs every weekday at 7:30 p.m. on NTA News 24. You can also check out this episode and others on www.youtube.com/NTA News 24 Hub. I am your carrier, Clinton. Goodbye. you.